UNRWA was clear about in their statement that it is unnecessarily impossible to deliver aid inside of Gaza because of the siege. This siege that is imposed by the Israeli military is making it very difficult to provide aid inside of Gaza, especially in the north, because they have blockaded the north entirely and cut it from all the global community. Other parts of Gaza also, they do unnecessary checkpoints, and they even turn back aid trucks just for very, let's call them silly reasons, that they are not written anywhere in any regulation that prohibits entering some aid, especially medical aid and food assistance.
So would you say, you say that they're turning back trucks for silly reasons. So would you say that this is a deliberate attempt to starve the people of Gaza?
Of course, this is a deliberate and systemic attempt to starve the people of Gaza, which goes under their general policy of genocide against Palestinian people inside of the Gaza Strip. Because there is nothing that justifies what the Israelis are doing in terms of preventing aid in all its types to enter Gaza, rather other than they want to inflict genocide and forcibly evacuate Palestinians outside of the Gaza Strip, while also making it inhabitable after the war.
Now, winter has arrived. Could you tell us what conditions people in Gaza are facing as the cold and rainy season begins?
Unfortunately, it's more severe than last year. This year, there is literally no gas or any type of oil that would help Gazans to get some sort of warming sources. In addition, there is no, of course, wood to use. So people are, burning their own material and stuff they have at their homes or in their tents to be able to provide warmth for their children. In addition, also add to that the severe cut of food assistance. This leads to, combined with cold and winter, this will lead to severe diseases, and more deaths will be recorded in Gaza because of starvation and the cold weather.
Yeah, from what you describe, of course, it is a dire and terrifyingly devastating situation. What are the potential long-term consequences of halting these aid deliveries for the population in Gaza?
Well, first is the diseases that could result from these circumstances that, again, Israel is creating. They're not natural circumstances. Israel is creating to inflict pain and to forcibly evacuate Palestinians from the Gaza Strip. In addition to having a higher number of deaths, plus there will be, since the destruction of homes and neighborhoods is still ongoing by the Israeli military, this will also lead to making the Gaza Strip inhabitable after the war.
And of course, there has been many reported attacks on aid workers. Are there measures that can be taken to ensure the safety of humanitarian workers in Gaza?
Well, the measures are already there. They just don't want to follow them, the Israeli military. And they are deliberately attacking. Like last year, they started with, let's say, they started targeting international organizations with the World Central Kitchen. But then after the condemnation statements, nothing happened. So Israel now is encouraged to do more of these crimes in order to cut all possible sources of nutrition for Palestinians.
You mentioned there that they've continued to do this, Israel, and nothing has happened. In what ways could international organizations put pressure on for Israel to adhere to humanitarian law?
Well, for starters, there should be, no country or state across the globe that refuses to implement the ICC warrants against Netanyahu and Gallant. They also should cooperate with the ICC with provide it with more evidence if they have it, and make their job easier. The Security Council is completely paralyzed because of the veto exercised by the U.S. Other than that, there is the International Court of Justice that is already issuing provisional measures, but Israel is not committing or complying with these measures. The responsibility to make Israel comply with these measures lies also within the Security Council, which already is paralyzed and will not issue anything that could force Israel to stop its genocide against the Palestinian people.
And what would you say are the key challenges that are faced by humanitarian organizations operating?
Well, the first thing is that all of them are living inside of Gaza, so they are experiencing the same circumstances as any other Palestinian inside of the Gaza Strip. Other challenges is that they are now made targets by the Israeli military, and we've seen the systemic targeting of aid workers and humanitarian assistance workers. Even medical workers have been targeted and systemically for over a year now, and nothing is happening. So in addition to the genocide circumstances they're living in, they're also being a target themselves to the Israeli military.
And could you describe for us the current state of healthcare facilities in Gaza? How are they managing to cope with the influx of casualties from the ongoing attacks?
Well, out of 36 hospitals inside the 80% of these hospitals are out of function completely. The rest functions, but not in their full capacity, as if it was the normal circumstances. How are they managing? Well, they are not managing. They are working with what they have. They don't even have anesthesia. This has been reported not just by Euromed, by many other organizations and UN agencies, that doctors and medical teams have operated on children and people without using any anesthesia. Also, there is no the medical supplies that are used for pregnant women are not also allowed. This is one of the silly conditions the Israelis are putting on aid. They are not allowing, for example, any medical supplies that are needed for pregnant women inside of Gaza. There is no military objective that could justify that also. So these medical facilities, let's call them, are operating in very harsh conditions. They are doing what they can with what they have, although there is much need for medical supplies, for even fuel to operate the generators for the hospital and all of that.
UN experts have expressed their alarm over allegations of human rights violations against Palestinian women and children. Of course, what you were just mentioning there about the inability to access healthcare for pregnant women would probably come under that. What do you make of this, and do you have any examples of these kind of human rights violations?
Well, there is nothing to make other than this is a textbook genocide, because, as I said, there is no military objective that justifies preventing medical supplies to enter the Gaza Strip. We have seen even operations by, on amputations on children without anesthesia. These are many cases have been reported of doctors operating such operations. This all happening under the eyes of the global community, with only statements condemning Israel's practice. without showing any real, let's call it, provisions or measures that could prevent the Israelis efficiently from performing their genocide against Palestine.